Hi, my name is Jordan Lawley, and today I am going to be talking about chronic kidney disease, or CKD, which refers to the gradual loss of kidney functions over time. The kidneys are an essential organ that filters wastes, regulates blood pressure, balances electrolytes, produces hormones, really filters everything that is going through your body to keep what is essential and get rid of waste. And when CKD develops, this is when the kidneys lose the ability to perform these functions effectively. So the body is not filtering out what it needs to. And chronic kidney disease is classified into 5 different stages based on your level of kidney function, and this is measured by a test called the GFR, or the glomerular filtration rate, which pretty much just measures how well your kidneys are filtering through. And this is based on the amount of creatine in your blood, because creatine is a waste product, so it's able to measure how well your kidneys are able to filter that waste product out of your blood. And within those 5 stages, you see different levels with that GFR. So stage 1 would be some kidney damage, and then stage 5 is kidney failure. And then the levels in between have varying GFR rates. And so the primary cause of CKD, there's 2 main causes. We see diabetes. Diabetes, both type 1 and type 2, causes high blood sugar, which damages the kidney vessels over time, and then can lead to chronic kidney disease. Another very common cause would be hypertension, high blood pressure, because this causes excess pressure on the kidneys, causing harm, which over time, again, can lead to chronic kidney disease. Some less common causes, we see the inflammation of the kidneys, filtering units, and then again, if that inflammation is sustained over a long period of time, that can cause damage. And then also, polycystic kidney disease causes cysts to form in the kidneys, which decreases the function as well. So both of those, while less common, can still lead to chronic kidney disease as well. And chronic kidney disease is pretty obvious, is a renal syndrome. So because it has to do with your renal functions and it is the kidney, it falls under that. And again, in order to diagnostically test to see if that you have chronic kidney disease, as I said earlier, there's that GFR, the glomerular filtration rate, to check for that creatine and seeing how well your kidneys are filtering out waste products. And in addition, providers will also do a urine sample to check for a protein called albumin, which is another indicator of chronic kidney disease. And then a differential diagnosis, we see acute kidney injury, which is, while has the same effects, it's the damaging of the kidney's ability to function properly. Acute kidney injury is caused by a sudden event like dehydration or some sort of toxicity to your kidneys. And so it's not this over time gradual loss of function. It is a very sudden event. However, this can be reversed if caught in time, unlike chronic kidney disease, where typically it is irreversible. While you can manage it and do things to maybe slow down the progression, acute kidney injury can be reversed. And then possible complications of not, treating your chronic kidney disease, or just potential if you are at a later stage. So we see that CKD increases your risk for heart attacks and strokes. We also see bone disease because of the disruption of the calcium and phosphate balance. We see the weakening of bones due to the loss of those vitamins that are necessary. And then, as I said earlier, there is that end-stage renal disease, which requires dialysis or a kidney transplant for survival. So you are unable to survive on your own with your own kidneys. You need something like a transplant or dialysis in order to survive and go about your daily functions. So as we have seen throughout this presentation, pretty much the key is early detection. So once you get into those later stages, it becomes very dire. There's very few treatment options, like we said, the transplant and dialysis. However, if you're able to catch it early, based on signs and symptoms, then you have a much better chance of living functionally with a kidney, your own kidney. So those signs include fatigue and weakness. We see swelling in the hands, the legs, and the face. We see excessive urination, but a lot of the time it's because your kidneys are not functioning properly. We also see decreased appetite, some nausea, irritated skin, shortness of breath, and then high blood pressure that is difficult to control. So all of these symptoms are important signs to look at to determine early on if you are or have CKD in order to stop that progression before you get to stage 5 and require a transplant of sorts or potentially go into renal failure. Thank you.